The topic is preterm labor. Preterm labor differs from regular labor because the baby is born early. Now, a term pregnancy is anything after 37 weeks gestation, with 39 weeks gestation really being the sweet spot for the baby to develop and be ready for the outside world. On the other hand, preterm labor happens when the baby delivers before 37 weeks. Preterm labor looks very similar to normal labor. Patients develop regular, painful uterine contractions that cause the cervix to dilate and soften. Preterm labor is divided into several categories depending on how early the baby is. Very preterm labor is any gestational age less than 32 weeks. Moderately preterm is 32 to 34 weeks, and late preterm is 34 to 37 weeks. The reasons why we make the distinction between very preterm, moderate preterm, and late preterm is because management differs. The more preterm the gestation, the more interventions we need to take to make sure that the baby is set up for success on the outside. When you're thinking about who might be at risk for preterm delivery, you can sort of think about it as why mom might want the baby to come out early and why the baby might want to come out early from mom. Moms who have a history of a prior spontaneous preterm birth are more likely to have another preterm birth. Moms who also have what we call a short interval pregnancy, meaning that between their last delivery and their next is anywhere between 6 to 18 months, those moms haven't really fully recovered from their last pregnancy, and therefore their bodies aren't really prepared to have a full-term baby in the next. Now, one of the reasons why the baby might want to leave mom early is if mom has an infection, and that's usually an infection of the genitourinary tract. That can cause contractions and early delivery of the baby. Moms who are on the younger side and the older side are also more likely to deliver early. Another great risk factor is whether or not the uterus is overdistended, meaning that the uterus is already too full and ready to deliver. This can happen with very big babies and more commonly if there are twin or triplet pregnancies. And finally, moms who smoke tend to deliver earlier. This is because smoking compromises the amount of blood flow to the placenta and to the baby. Now, I mentioned how preterm labor presents very similarly to normal labor. However, depending on how early or how preterm the patient is, you might find someone who has the normal painful uterine contractions, or sometimes it can be a little more subtle and just present with lower back pain. In any case, patients who develop new low back pain or new abdominal pain should be evaluated. The reason why preterm delivery is so serious is because it is a significant cause of morbidity and mortality among newborns. Most preterm babies have a low birth weight because they are born too early. Another issue with prematurity is that not all of the baby's organs have been fully developed and normally functioning. The biggest risk is for the baby's lungs to be underdeveloped. This can cause something called respiratory distress syndrome in a preterm baby. In addition to having underdeveloped lungs, preterm babies can also have patent ductus arteriosus. Normally, the ductus arteriosus closes in late pregnancy so that when babies are born at term, their blood flow is normal. Preterm babies, on the other hand, have a ductus arteriosus that remains open, and therefore blood is being sent to the wrong place and not enough blood is reaching the extremities. Preterm babies are also at risk for something called intraventricular hemorrhage, which means bleeding in the brain because the brain is underdeveloped. Perhaps one of the most serious complications of prematurity is a condition called necrotizing enterocolitis. Babies who are born preterm have less defenses against infection. Bacteria that enters the gut can actually cause an infection so severe as to cause necrosis of the small and large bowels. This is seen in the picture on the right. This can also lead to perforation, abdominal distension, and erythema of the abdominal wall. The reason why we take preterm delivery so seriously is because preterm babies can suffer a lot of complications. Luckily, there are interventions that we can take to protect the baby from those complications as best as possible. Now, I mentioned how the more preterm the baby there is, the more interventions we need to do. One of the first interventions is giving magnesium sulfate. This is given in order to decrease the preterm baby's risk of cerebral palsy, otherwise known as fetal neuroprotection. The next step is tocolysis, which are medications that are given to stop uterine contractions to buy some time for other interventions. One of those important interventions is corticosteroids, such as betamethasone. Corticosteroids are really important because it helps jumpstart development of the lungs, such that babies who are born premature are less likely to have that neonatal respiratory distress syndrome we mentioned. Finally, because preterm babies are more at risk for developing infection, we generally give antibiotics, like penicillin. This protects them from a bacteria called Group B streptococcus. When moms come in and appear to be in imminent preterm labor, it's very important that we notify the neonatal resuscitation team right away. And during the course of labor, have continuous fetal monitoring to make sure that the baby is doing okay. And because preterm labor is almost never expected, the last important thing is to be able to provide emotional support to the mom and their partner.